Welcome to today's presentation. Today, we're going to start with an important topic, Introduction to Personal Hygiene. Personal hygiene basically means keeping ourselves clean and well-groomed. It's about taking care of our bodies in a way that promotes health and well-being. Maintaining good personal hygiene is essential, not just for our comfort, but also for safety. It helps prevent infections, which is especially critical in nursing care, where we're caring for vulnerable individuals. As nurses, we need to pay attention to both our own hygiene and that of our patients. Ensuring that both ourselves and our patients are clean and well-groomed is a key part of providing effective and compassionate care. Remember, good personal hygiene is a foundation for overall health and plays a vital role in our daily responsibilities as caregivers. Let's talk about the importance of personal hygiene. First, maintaining good hygiene is essential because it directly promotes our health and helps prevent infections. When we keep ourselves clean, we reduce the risk of germs and bacteria that can cause illnesses. Secondly, good personal hygiene also improves our comfort and self-esteem. Feeling clean and fresh makes us more confident in ourselves and can positively impact our interactions with others. Another critical point is that proper hygiene plays a vital role in preventing the spread of hospital-acquired infections. This is especially important in healthcare settings, where vulnerable patients are at higher risk. Finally, when everyone practices good hygiene, it supports faster recovery for patients and increases their overall satisfaction. When patients see that hygiene standards are upheld, it reassures them and promotes a healthier environment for everyone. So, as we see, personal hygiene isn't just about looking good. It's a key part of maintaining health, safety, and well-being in any setting. Let's talk about the principles of personal hygiene. First, it's really important to always maintain the privacy and dignity of the patient. This means respecting their personal space and making sure they feel comfortable and respected during hygiene care. Next, we need to ensure their safety and comfort at all times. This involves using gentle techniques and being attentive to any signs of discomfort. Following medical asepsis techniques is crucial to prevent infections. This includes proper hand hygiene, using clean supplies, and following protocols carefully. Lastly, whenever possible, we should encourage the patient to participate in their own self-care. Promoting independence helps boost their confidence and supports their overall well-being. Together, these principles help us provide respectful, safe, and effective hygiene care, aligning with our goal of patient-centered care. Now, let's take a look at the different types of hygiene that are essential for maintaining overall health and well-being. First, we have oral hygiene, which involves taking good care of your mouth and teeth. Brushing regularly and flossing are key to preventing dental issues and keeping your breath fresh. Next is hair care, which includes washing and combing your hair. This helps to keep your scalp healthy, remove dirt, and prevent scalp conditions. Proper hair care also contributes to your overall appearance and confidence. Nail and hand care is equally important. Trimming your nails and keeping your hands clean helps prevent infections and maintains good hygiene. Clean hands are especially vital since they come into contact with many surfaces throughout the day. Then we have eye, ear, and nose care. These are your sensory organs, so keeping them clean and free from infections is crucial. Gentle cleaning and avoiding exposure to irritants help protect your vision, hearing, and sense of smell. Perineal care involves cleaning the genital and anal areas. This is particularly important for hygiene, comfort, and preventing infections. Proper hygiene here supports overall health and dignity. Finally, foot care is especially significant for individuals with diabetes. Proper foot hygiene, including regular washing, inspection, and moisturizing, helps prevent complications like infections or ulcers. All these hygiene practices are interconnected and contribute to your overall health, comfort, and confidence. Maintaining good hygiene is a fundamental part of caring for yourself and supporting your overall well-being. Let's talk about oral hygiene and why it's so important. Oral hygiene involves cleaning the teeth, gums, tongue, and mouth to keep everything healthy. Maintaining good oral hygiene helps prevent issues like halitosis, which is bad breath, and also stops oral infections from developing. When choosing tools, it's best to use a soft bristle toothbrush along with a mild toothpaste to avoid damaging the gums and teeth. For patients who are unconscious, we need to adapt our approach, using sponge sticks and suction to ensure they stay clean and comfortable. Overall, good oral hygiene is a vital part of overall health, and understanding these methods helps us provide better care. Let's talk about hair and scalp care, which is a vital part of overall hygiene. Keeping the scalp clean helps prevent common issues like lice and dandruff, which can cause discomfort and skin problems. When caring for hair, it's important to comb gently to avoid pulling or tangling the hair, especially for those with delicate scalps. Regular washing is also key. This keeps the scalp free of dirt and excess oil, and make sure to dry the hair completely to prevent fungal infections or scalp irritation. For patients who are bedridden, regular washing might be challenging, so using dry shampoo or the bed shampoo method can be really helpful. These techniques effectively cleanse the scalp without the need for water, making it easier and more comfortable for them. Overall, consistent and gentle hair and scalp care not only promotes cleanliness, but also enhances comfort, which ties into our broader goal of maintaining dignity and well-being for everyone we care for. Let's talk about nail and hand care, which is a key part of maintaining overall hygiene and preventing infections. Short, clean nails are essential because they reduce the risk of bacteria and dirt trapping underneath, which can lead to infections. It's also important to regularly inspect your nails for any discoloration or signs of fungal infections, as early detection can help prevent more serious issues. Before trimming your nails, soaking your hands in warm water makes the process easier and more comfortable, softening the nails and skin. Additionally, always remember to use gloves during patient care to protect both yourself and your patients from potential transmission of germs. These simple practices are vital for promoting health and safety in any care setting. Let's talk about eye, ear, and nose care now. When cleaning the eyes, it's important to do so from the inner canthus to the outer canthus, using sterile water to avoid introducing any bacteria. This helps keep the eyes healthy and free from irritation. Moving on to the ears, always wipe gently. Never insert objects into the ear canal, as that can cause damage or push dirt further in. Gentle cleaning is key here to prevent discomfort or injury. For the nose, clean the nasal passages if they become obstructed, which can help with breathing and comfort. Finally, always observe for signs of redness, discharge, or any infection. Noticing these early is crucial for prompt treatment and preventing more serious issues. Overall, proper care of these sensory organs is vital, not just for comfort, but for overall health. It ties back to our theme of comprehensive patient care, emphasizing gentle, attentive hygiene and vigilance for any signs of trouble. Let's talk about perineal care, which is really important for preventing urinary and genital infections. Keeping this area clean helps avoid complications and promotes overall health. When performing perineal care, always maintain privacy to respect the patient's dignity, and use warm water with a mild soap, nothing too harsh or scented. That's gentle on the skin. It's crucial to wipe from front to back, as this technique helps prevent contamination from bacteria that might be in the anal area from reaching the urinary tract. This practice is especially important after childbirth, surgery, or when caring for patients with catheters, since these situations can increase the risk of infection. By following these simple but effective steps, we can help our patients stay comfortable and prevent infections from developing. Now let's talk about bathing, which is a vital part of patient care. There are different types of baths we might provide, including a complete bed bath, a partial bath, a tub bath, or a shower. Each type serves different needs and situations. Giving a bath helps improve circulation and overall comfort, which is essential for a patient's well-being. While bathing, it's important to observe the skin carefully. Look out for redness, rashes, or signs of pressure ulcers, because early detection can prevent complications. Also, always maintain the water temperature at a safe and comfortable level and ensure privacy for the patient to promote dignity and trust. Remember, proper bathing isn't just about cleanliness. It's also about promoting comfort, safety, and skin health, all of which tie into our overall goal of providing holistic, compassionate care. Now, let's talk about foot care, which is a crucial part of maintaining overall health, especially for those with specific health conditions. First, it's very important to wash and dry your feet thoroughly every day, paying special attention to the areas between the toes. This helps prevent infections and keeps your feet healthy. Next, always inspect your feet carefully for any cracks, sores, or signs of infection. Catching these early can make a big difference in preventing more serious problems. It's also essential to avoid cutting your nails too short, as this can lead to ingrown nails or injuries. And this point is especially vital for diabetic patients because they are at higher risk of developing foot ulcers. Proper foot care isn't just about cleanliness, it's about proactive prevention. By taking these simple steps, we can help prevent complications and keep our feet healthy for the long term. Today, I want to talk about the nurse's role in personal hygiene. First, it's important to assess the patient's ability for self-care. This helps us understand what they can do independently and where they might need assistance. Based on that, we can plan and assist with hygiene activities according to their individual needs, ensuring we promote their dignity and comfort. Always remember to provide privacy and clearly explain each procedure before starting. This not only respects the patient's privacy, but also helps alleviate any anxiety they might have. When assisting with hygiene, we must use aseptic techniques to prevent infections and ensure the patient's safety. At the same time, we should focus on making the experience as comfortable as possible for them. Finally, it's essential to document all care provided and any observations we make. Proper documentation helps us track progress and communicate effectively with the rest of the healthcare team. Overall, our role in personal hygiene is about supporting independence, ensuring safety, and maintaining dignity, key elements that connect directly to the overall goal of patient-centered care. Now, let's talk about infection control during hygiene. It's crucial to emphasize hand hygiene both before and after providing care. This simple step helps prevent the spread of germs and keeps both patients and caregivers safe. Next, always remember to use gloves and protective barriers when necessary. They serve as a physical shield, reducing the risk of cross-contamination and protecting you from potentially infectious materials. Proper disposal of waste and linens is also essential. Disposing of these items correctly minimizes environmental contamination and helps maintain a clean, safe environment for everyone. Finally, it's vital to follow hospital infection control protocols at all times. These protocols are designed based on best practices and evidence to ensure the highest level of safety. By adhering to these key points, we can uphold the overall theme of providing safe, effective, and professional care through proper hygiene practices. Let's take a moment to summarize what we've discussed. Personal hygiene is absolutely vital for overall health, comfort, and dignity. When we think about our patients, maintaining their hygiene isn't just about cleanliness, it's about supporting their well-being and respect. Nurses, in particular, play a crucial role in this process. We are often the ones who ensure that patients are clean, comfortable, and cared for in a way that promotes their dignity. Our involvement helps prevent infections and also enhances their comfort during recovery or daily life. Prevention of infection is a key goal in our work, and good hygiene practices are central to that effort. At the same time, promoting comfort is equally important, making sure patients feel relaxed, cared for, and respected. So, in essence, personal hygiene ties everything together: health, comfort, and dignity, and underscores the importance of our role as caregivers in maintaining these standards. And that brings us to our references, which are essential to support the information we've covered today. First, we have Potter and Perry's Fundamentals of Nursing, 10th edition, a comprehensive resource that provides a solid foundation in nursing principles. Next is Cozier and Erb's Fundamentals of Nursing, 9th edition, which emphasizes practical approaches and clinical reasoning. We also looked at Taylor, Lily's, and Lynn's Fundamentals of Nursing, 8th edition, known for its clear explanations and focus on patient-centered care. Lastly, the Indian Nursing Council's Nursing Foundation syllabus guides the standards and curriculum that shape our nursing education and practice. These references highlight the importance of evidence-based practice and continual learning in our profession. They serve as valuable tools to deepen our understanding and ensure we deliver the best care possible. Remember, staying updated with reputable sources like these is key to maintaining professionalism and excellence in nursing. Thank you for your attention and dedication to this vital field.